Yes, with the both the charity and the global coalition, we're about advocacy for radiotherapy, and particularly with respect to London Global Cancer Week, we helped launch a planning meeting for a World Radiotherapy Awareness Day, and also had sessions on how we can improve radiotherapy globally, and then also did some work around healthcare disparities. That was a great panel discussion about healthcare disparities. We had a lot of contributions from all over the world, particularly looking at having spent the morning hearing different areas. And what became very clear is that the healthcare disparities are due to multiple reasons, and they are very individual for certain countries, and yet at the same time there is very much commonality against lower and middle income countries and even higher income countries. And it seems to be that any solutions that are put forward have to be multifocal. It may be to do with women's issues, it may be to do with money, it may be due to travel, it may be due to conflict, or a number of these reasons, and they all have to be taken into account. And what was clearly concluded at the end is that cancer affects us all, obviously 1 in 2 people. It is managing cancer in a country has so much to do with everything from transport, education, economics, that essentially it's a political problem, and that solutions need to be sought at a national level in terms of how nations are dealing with their non-communicable diseases, and in fact cancer, and then how the global community can provide some sort of support and advice and interaction. But it's clearly a big problem. Well, I think obviously I would leave that to the speakers who we heard from, but a lot of it was in terms of local initiatives that had helped, but obviously there was the larger initiatives. We had talks from Canada on the panel in terms of how the Inuit population dealt with and how they could be helped there. There was another mention on the panel about perhaps as high income countries, we should be giving more to aid to lower and middle income countries. We heard from the NIH about all the work they've been doing in research and how it is so multifactorial, but we must be linking all of these things to help, and how there is research that can help. And also from the Dawn Butler, the MP who kindly hosted the event, a UK MP, talking about her own experience and what in the UK we can do. Lots of it ends up being communication. We heard a lot over the week about getting to populations with talking about them from the voice of their culture, or even in their language, or even from people of their own like men talking to men, women talking to women. And it so relates to finding individual solutions that takes all these things into account. There's not one solution, but clearly there are a lot of multiple solutions. And what came over very clear at the meeting is that funding globally for cancer used to be thought perhaps the individual should do that, particularly in Africa. They have had that. That was apparently not very well done at all, because there's so much out-of-pocket expenses, and that didn't work. There's not to be a global cancer fund like donations like for aid, but it's best dealt with at a nation level, and therefore the message has got to get through clearly to the governments that health is important, non-communicable diseases are important, and cancer is really important in that. Cancer is increasing in lower income countries, and while we've perhaps gone a long way to eradicate 0 to 5 deaths and vaccination, etc. Now people in their 30s are getting cancer, and if that's not looked after, that's going to affect the economy of the country. So it's an emerging story, and by sharing the story, then we can see clearly and then help people better.